In our female health feature today, we're going to be focusing our attention on hormones and women's reproductive years. And for this discussion, I'm joined in studio by Sister Elise and Dr. Mark from the T Clinic. Welcome both of you. Nice to have you with us again.
Thank you.
Now, we're talking reproductive years. When do they officially start and end? Elise, let's start with you maybe.
Okay, I think Mark will answer that question.
Okay, so Michael, reproductive years basically start when you start menstruating until you finally stop menstruating. Now, we've seen 10, 11-year-olds, 12-year-olds fall pregnant without a regular menstruation. And we often hear about women in their 40s that fall pregnant. I think the oldest woman to give birth naturally was 63.
Oh, wow, okay.
So, you know what, until you finally stop menstruating, you're still reproductive. Those are the reproductive years.
Right. When you are in your childbearing years, what are the major imbalances that we're looking at in terms of the swings and roundabouts of hormones?
Okay, I think we need to understand that hormone imbalances can mean I have too much hormones or too little hormones.
Right.
And that is a very important factor. And yes, there is imbalances. And in the beginning of our reproductive years, when we start menstruating, we are in an imbalance period.
Okay.
Because you don't menstruate regularly, you don't ovulate regularly. But throughout the reproductive years, and usually into puberty and in young 20s, there's the imbalance time, and then towards your end of your reproductive years, then we talk about the perimenopausal years, and that can also be naturally imbalances that happens there.
Okay.
Do you agree?
Yeah, absolutely. I think, Michael, when we look at imbalances during these times, it would be good to look at conditions. And the one that I think jumps to mind and is thrown around quite often is polycystic ovarian disease, Elise?
Yes,
PCOS.
or known
Yes,
as
PCOS.
PCOS, yeah. Now, there's different things that happens in the body for PCOS to take hold of your and that is also then an imbalance that happens in your sexual hormones as well as your sugar.
When we look at the hormone imbalances that we relate to PCOS, it would be metabolic, insulin levels, which leads to inflammation, like we discussed last week.
And higher androgen levels.
Higher levels of circulating androgen, which causes the difficulty in ovulating, and it causes that excessive hair growth.
Right.
So PCOS, we see these girls overweight, acne, difficult menstruation, often associated with pain, and that can be because of endometriosis, which is one of the other very serious conditions that we see during our reproductive years.
Okay. Elise, maybe you could just go a bit deeper into endometriosis for the viewers to understand it.
Yeah, so endometriosis is where it says what it is. Now, endometrium is the inner layer of our uterus that sort of matures to receive a fertilized egg, to carry a pregnancy full time. Now, when endometriosis is usually where that layer that inner layer breaks down and we menstruate, and then that travels through our ovarian tubes into our abdomen or pelvic area and attaches it to tissue there and grows there. And during your menstrual cycle, that piece of endometrium then sort of bleeds like you would bleed when you have your period every month.
It reacts exactly the same as your endometrium under the hormonal influence.
Right.
Yeah.
Okay.
So,
And then a lot of women struggle with irregular period. What is the cause of that?
okay, I think we need to define what is irregular as first. So, when you have a period over a cycle from less than 24 days or more than 38 days, it's classified as an irregular period.
Right.
Okay. And then some months you have it, some months you don't have a period. That's also irregular. And it's usually 3 to 4 days that you menstruate, and that's classified as regular. Otherwise, it's always seen as irregular.
Okay.
Endometriosis can be a cause of irregular periods, and then different things like anovulation, which we call anovulation means you don't ovulate,
Okay.
so your period's irregular. The other thing is primary ovarian insufficiency.
The other one is conditions like anorexia, bulimia,
Yes.
where your fat percentage is so low that you don't convert enough estrogen,
Okay.
or don't produce enough estrogen. So there's various conditions. Certain medication can create irregular periods. Now, one of the things that we often see in our practice is when patients use contraception.
Yes.
Right.
And
Specifically
different
birth
types of
control
contraception.
pills.
Okay. So you say these birth control pills specifically. Now, just explain to us why this is a thing, because is that because the birth control pills are causing a purposeful disruption to hormones to stop the natural ovulation process?
And it's cyclical as well,
Okay.
hopefully cyclical. The first 3 weeks of the tablets is a certain hormone, and then the last week is
Right.
either a placebo or a different kind of hormone.
Okay.
In that period, and that's synthetically changing
Yes.
hormone production.
So different type of contraception, when we, for instance, decide we're going to stop the contraception and we want to try and fall pregnant. So certain of these contraceptive methods, for instance, our injectables,
Yes.
can cause a period after cessation where we do not ovulate and where you do not have a cycle. And then it starts with a very irregular cycle. And that can continue for up to a year.
Oh, really?
Most of our oral contraceptives, when we stop them and you had a regular cycle during the contraception, some of these patients then manage to have a normal natural cycle quite quickly and fall pregnant. Some of our intrauterine devices or implants that we do in the uterus itself, I find them to be quicker in getting a natural
regulating
cycle
your
back.
Okay.
So there's various things that during the reproductive years can cause irregular cycles, painful cycles, excessive bleeding, etc., etc. And if you battle with any one of these, it's prudent to go and see your practitioner, your healthcare practitioner. It's sometimes not easy to get to your gynecologist,
Yes.
and therefore there's places like us.
Yeah.
Okay. In terms of people who suffer from irregular menstruational periods, what would the usefulness of, or would you engage in hormone replacement therapy, or is it a system of balancing and moderating through other means?
Michael, I think we first need to decide and be aware of, are there any comorbidities?
Okay.
So do we need to manage thyroid? Do we need to manage insulin? Is there any other hormones that are out? And here we can go back into our hormone cascades, where we look at follicle stimulating and luteinizing hormone that's produced by the brain in the pituitary gland that stimulates the ovaries for ovulation. Now, we also then need to look at our steroid hormones, the testosterone, the androgens, our progesterone and estrogens, and balance those levels. It's all about creating this balance so that the symphony of the hormones that we like to refer to is conducted in a way where everything comes in on cue.
Right.
Otherwise, all you have is noise. So it's about understanding what you are going through and how that is responsible for the imbalances, how those imbalances need to be corrected, because if done, like we said with a cake, if one ingredient changes, the whole cake changes. So
Yes.
it's about that fine balance and just fine tuning. And this we can do with hormone optimization therapy, regulating periods through progesterone, estrogen, etc., nutrition, supplementation.
Okay. Mark, if people want to get a bit more information, find out, how can they get hold of you?
Elise always says Facebook. The website, www.thetclinic.com. Phone number 010-824-1393.
Wonderful. Mark, Elise, thank you so much. Some great insights there, as always.
Thank you.